All right, welcome back. Another episode of Bread and Butter Primary Care. I'm Dr. Stokes. We're going to be doing just a little bit more on blood pressure. It's interesting how this channel's been coming together as I've just started. I keep thinking that I'm finished, and then I keep having these ideas to, oh yeah, I should talk a little bit about this. Oh yeah, plus a little bit about this. And so um, today, this video is entitled Hypertension, Routine Monitoring, and labs. Okay, so the question would be, you have someone in your office, you've checked the blood pressure, you've diagnosed them with essential hypertension. What things do you get routinely as far as like lab evaluation and whatnot? And then how often do you need to see that person? And what kind of things do you need to monitor? So those are the two questions we're going to answer in today's video. So question number one, what do you get upon initial diagnosis? The way I like to think about this is looking at it from a perspective of comorbid conditions, things that might have been damaged by the blood pressure, and things that will need to be monitored in the future. Okay, so comorbid conditions. Blood pressure, as we've talked about before, has a lot to do with lifestyle, has a lot to do with obesity and those types of things. So when someone has high blood pressure, they have a higher chance of having diabetes. They have a higher chance of having a high cholesterol problem. And so those are two things that you would check in a hypertensive patient. So a fasting lipid panel and a fasting sugar, which you'll usually get with your metabolic panel. So that's comorbid conditions. The other thing is what might have been damaged. So the two main ones that come up there, if you're diagnosing someone with hypertension, you don't know how long they've had it. They could have had it for 10 years. It might be a new thing. The heart goes under a lot of strain because of high blood pressure, because it's working against a higher pressure all the time. And the kidneys can suffer damage because of high blood pressure. Those are probably two of the most common and early onset problems with people who have high blood pressure. And so a renal panel to check your kidney function and find out how they're working, and an EKG to see what the state of the heart is. Is there some left ventricular hypertrophy? I, in the past, haven't routinely gotten EKGs just on my hypertensive patients, but I was at a conference in November. They recommended that. I've done some reading on it since, and most sources that I can find now are recommending to go ahead and get an EKG with someone with a new diagnosis of high blood pressure. And I think that's partly, like I said, to see if something's been damaged yet, and also to have something to compare to. The most valuable thing when you are evaluating an EKG in any situation is a previous EKG to compare that to. So getting that initial EKG, having it in the chart, having it ready, is a pretty valuable thing to have. So comorbid conditions, diabetes and lipids, what might have been damaged, EKG and renal panel, and what will you need to monitor. Most of the medications you're going to use to control blood pressure can affect the electrolyte levels, potassium, sodium, etc., and they can affect kidney function. So again, the renal panel comes into that one as well. And so generally speaking, and with the kidneys, urine sample. Check to see if there's leaking protein in the urine, to see if another way to check and see how the kidneys are doing. Okay, so in general, the general panel you're going to be looking at, a renal panel, both for the electrolytes and the kidney function, a urinalysis to check for any sort of protein problems, an EKG to have a baseline and check if the heart's been hurting at all, and then the screening for lipids and the screening for diabetes. I've seen also a CBC listed in some sources as something to check, as well as a thyroid. Those, again, aren't things I check routinely just because of blood pressure, but certainly something to keep in mind that you could do earlier versus later on in the evaluation, depending on the patient. So there's kind of the initial things that you want to collect going forward. And so then, second question for the video, monitoring. How often do you need to see a blood pressure patient, and how often do you need to be checking in on physical exam things as well as laboratory monitoring? Usually what I do, and I think this is something that different providers are going to choose to do it different ways, which is fine. I'll kind of let you know what I do. I think I probably kind of sit in the middle compared to most, and so I make an initial diagnosis. At that diagnosis, they're started on whatever the initial blood pressure medication is, and then usually it's a 1 month follow-up if it's just essential non-urgent hypertension. If there's a hypertensive urgency or something where the numbers were a lot higher or something, I'll check back sooner than a month, but usually start them on a medicine, see them back in a month. At that first visit, you get the initial labs. So initial labs, start a medication, see them back in a month. You want to repeat the renal panel at that 1 month follow-up, especially if you've started an ACE inhibitor. I mentioned this in a previous video. ACE inhibitors, very healthy for the kidneys, very helpful for kidney protection, but in some cases, like in renal artery stenosis, they can damage the kidneys. So you always want to start an ACE inhibitor, recheck the renal, make sure you haven't had a bump in the creatinine. So it's initial diagnosis, usually a 1 month follow-up to see how things are going. Once the blood pressure is controlled, we're not changing doses, we're not adjusting medications, everything's just kind of standard and set out, then usually I'll go 6 months. And so my well-controlled blood pressure patients who don't have any other problems, twice a year visits to check in, see how it's doing, make sure the medicines are going well, at least once a year recheck of the labs once I know they're stable. Every once in a while you have a really well-controlled hypertensive who doesn't have any other problems or any other conditions. They've been on medicine for years and it's always been good. I could see a case to be made to go to just a once-a-year visit. In my personal opinion, if you're on a prescription medication under the care of a physician, twice a year seeing that doctor to be checked in on is not too much. So that's the questions for this video. So review as we finish up here. Initial labs, you want to check for comorbid conditions, diabetes, cholesterol. You want to check for any potential damage, urinalysis, renal panel, EKG, and you want to check on things that you're going to need to monitor in the future because of the medications you'll be using, electrolytes. So there's your initial workup for a hypertensive patient, and then usually you're going to see them back in a month after they start medicine, recheck those labs once they're stable, every 6 months, maybe once a year if they're doing really well. And there you go, preventing heart attacks, preventing strokes, giving people a better, more healthy future. Hope you enjoyed the video. Any questions, comments, please leave those below and we can discuss those at a later time. And have a great night.